and good afternoon. Can you see me, Laura? Okay, I am going to,
not quite yet. I'm supposed to be on your Dr. Kimberly page, right?
I don't see it either. Do I try it again? It says stop live stream. So it says that, can you see us? All right. Well, good afternoon. My name is, and I am Dr. Kimberly Barrington, and you are rolling on the road with Dr. Kimberly and Dave. However, Dave today is rolling on another assignment. So we send good vibes to him as he's out and pray his safety. Today, our show is PTSD. Our soldiers are not the only ones who are suffering from it today. We have three awesome guests that we're going to bring on in just a second. Many of you just were so engaged on our show on Tuesday where we had Commissioner Womack, and he is a Kent County Commissioner representing District 17, and how we, yes, it was a very emotional show. And we saw some PTSD and past traumas that the Mr. Floyd situation really brought to the forefront. And many of us have seen how this COVID-19 pandemic has everyone focused on what's actually happening in America, and the scabs and the scales have been removed from persons' eyes. And we can really see what's happening in our world. And we all now have an opportunity to make some necessary changes as we begin to open up each city, each state, each region across the United States. We have an opportunity to re-engage and open up something new and something different. We know that we will have some medical changes as we move forward, as we begin to re-engage in our community. But now we have an opportunity to change some of the systemic issues that we've had in our country. And we have an awesome opportunity now as we write policies and procedures to make some of those systemic changes. So with that, I would like to invite to you Mr. Bill Ward, who is now joining us. He is the Executive Director of Kent County's Network 180. Next, we have Ms. Lauren Presutti, who is the founder and CEO of Presutti Counseling. And we have Dr. Nakpangi Thomas, who is the CEO of Thomas Traumatology Institute. Wow, that was a mouthful. Dr. Thomas, well, we're going to unmute her, and hopefully she will come in with her video. There she is.
Yes, I'm here.
Everyone is here. So good afternoon, everyone. I always say when we have more than 2 or 3 people, I feel like we're on the Brady Bunch. The Brady Bunch.
Right.
And I'm Cindy in my little curls. Can you see that? Y'all see my little curls? Yes. So.
Thank you, Dr. Kimberly, for having us.
Thank you again, Dr. Kim.
So as we know, Dave is rolling down the road on another assignment. So it is just me today. So we welcome you to Rolling on the Road with Dr. Kimberly and Dave. I think we sent you information as to how, what, where, when we started this, and we've done enough shows that everybody knows why we're here. But today we want to talk about post-traumatic stress disorder. I love definitions. I don't know about anybody else. How about you guys? You guys like definitions?
Exactly.
Especially you therapists?
Yes.
Definitely.
Yes.
Let's see.
So we know
And we are going to read your definition of PTSD. And many people think that it is only associated with soldiers. I
Not
believe
true.
that the first definition was considered, it was shell shocked. And it was given to those veterans that had come back from Vietnam. And for years and decades, it was, oh, they just shell shocked. They're just crazy. How many we all know we're not crazy, right?
Absolutely.
PTSD.
Yeah, for a long time it was, just thought of as soldiers coming back from their duty and from war. And what we've seen over decades of time is that that's not always the case, and that trauma is trauma, and everyone's trauma is valid and real, and it can show up in many different areas of life.
And we also know that the disorder is something in which has.
Can you your volume up a little bit?
Oh, let me see. I don't know. I don't think I can turn it up, unfortunately, but I can speak louder. We know this disorder affects people that have experienced trauma or witnessed trauma, and they have a difficulty time recovering from that traumatic experience. And it can cause emotional as well as physical difficulties.
Right. And I think the important thing too is that no case is identical, and no symptomology from one person to another person is going to be identical, even if two people experience the same car accident or the same traumatic life experience. The way that they internalize that and cope with that and really resonate with that experience might be really different from another person going through the same thing. And that's why I really try to talk about these types of issues with that mindset of knowing that PTSD or any trauma symptomology can show up in many different ways for many different people.
Yes.
Mr. Ward or Bill, I get to call him Bill by his first name.
Everybody gets to call me Bill.
Oh. I'm trying to feel special, Mr. Bill. Okay.
You should see at these community forums I do when people want to call me Mr. Ward. And I said, no, I work for you. I work for the citizens of Kent County. They can call me Bill.
Okay, with that being said, Bill, you are the executive director of Kent County's mental health. I believe it says that you're the expert at Network 180.
Well, I wouldn't say I'm the expert. I'm the executive director, and we have a wonderful staff and contracted provider network. We serve about 18,000 or 28,000 individuals in Kent County, ranging from individuals suffering from mental illness to individuals with intellectual and developmental disabilities, kids with autism, and people with substance use disorder. So really trying to help the most vulnerable of our population, and making sure that we can keep them safe and help them work through their goals, whether it be recovery, whether it be what their life goals, if they're intellectual developmental disabilities, or working with these youngsters who are struggling with autism. So we're trying to really serve this vulnerable population as much as we possibly can.
So my question would be to you, how often, because I'm an advocate to my heart, how often are you even called, or someone from your staff called down when there is an incident with the police and they're trying to retain a person that falls in one of those categories? And let's say, I'm autistic, most persons with autism do not like to be touched. Mm-hmm. They're just don't touch them. They can be at the top of the spectrum, even down to the lowest, don't touch them. But they don't wear, they're not carrying a card, they don't have a sign most people may not know, especially if they're high functioning within their autism. And let's say they steal something from the corner store. Hey, the owner sees them and calls 911 and says, hey, you know, this guy just stole something out of my store. He's running down the street. The police happen to be sitting on the corner. They see him. They go to arrest him. He resists because, oh my God, he freaks out. They're touching him. Mm-hmm. So now they're going to use excessive force. Mm-hmm. Who's there to represent him? Who's there to be a voice to say, hey, stop, time out. This is what's wrong with him, and this is how you need to handle him.
So there's a couple of things that we're trying to do. One of the things that we started the conversation, and I'm not going to say it's perfect, we're working on it, is we have what are called these crisis mobile teams that are available 24/7 that we can dispatch out into a situation like that to help diffuse that situation. Because what does that person really need? That really person needs a peer or a therapist that can help de-escalate that situation. On a proactive thing, and we need to do more of this too, is the National Council on Behavioral Health has come out with what they're calling mental health first aid, which is really, it's a training established and designed for first responders and educators, that they can actually start seeing some of these things that are happening if this incident is happening, to make sure that they de-escalate the situation before it gets worse. Now, we're a long way from making that a perfect, but it's a start. And we've been successful in having training first responders in mental health first aid, but we need to do much more. The crisis response mobile team is part of a bigger picture, a bigger plan of where we can get these other alternative situations where we can take these individuals where they can get the help that they need. You know, we're working on trying to get a secured lockdown facility with therapists that can work with these individuals, that they may need just like 10, 12 hours of de-escalation. They don't need to go into an inpatient unit. You know, we can send out a peer to work with this individual, someone who has life experience, someone who's done, experienced this kind of traumatic episode or psychiatric episode, that they can have, a peer talking to an individual that's going through this crisis can have a huge effect on de-escalating it. So we got a long road ahead of us, but I think we have a lot of tools available to us to get these types of services up and running throughout the county to help the folks that we need to help.
And
okay, with that being said, you live in Wayne County, Dr. Thomas. How many times have you been called out, or any of your colleagues, when a situation like this has arisen with the police department?
Unfortunately, here in Wayne County, I'm going to say I have never been called out personally by our police department to help de-escalate someone who has a mental health issue. And I think Bill is right on the money with our police departments need to be trained on how to deal with individuals with mental health disorders and how to identify these individuals. And we've seen it right here in Detroit, where a police officer actually physically attacked a woman that was in a mental health institution while they were trying to get her services. So there's a lack of training as well as a lack of empathy by some police officers when it comes to individuals with mental health issues.
Lauren, would you like to weigh in on this?
Sure, yeah, absolutely. I think that we absolutely need more training for those first responders. Bill, I'm so happy that there are those mobile crisis response teams and things like that in place. To your point of mental health first aid, I completed that training at Network 180 actually for adult and child. There's two versions, the adult version, the youth version. And I didn't think that there was quite as much curriculum in the training as there maybe could have been for these types of situations. At least when I completed it, it was about a year ago, and the training really largely focuses on de-escalating someone who is having suicidal ideation or someone that is going through suicidal thoughts and behaviors. And I didn't see as much in that curriculum about these types of de-escalation processes that maybe could have been in there. And so I just think there's always room for improvement. And I don't know the steps that could be taken to put some of these types of police encounter situations into that curriculum. But I think that could be something to look into, maybe just adding a segment in that curriculum that could be a little bit more targeted to working with people that have disabilities, because I think that could be helpful. And then, of course, on top of that, the crisis response teams sound wonderful, and that sounds like something that's specifically targeted toward this. So I'm very happy to hear that there are all these different tools and pieces to the puzzle that can come into play.
Yeah, and you can never stop evaluating curriculums like, you know, mental health first aid. You know, one of the things, the limitations of a program like mental health first aid is, since it is a national program, it has to go through the whole rigorous evaluatory process at the Behavioral Health Council. But another part of the curriculum that, you know, will also be helpful to these first responders is the trauma-informed care curriculum. And that you take the mental health first aid and you put it together with the trauma-informed care, and you really kind of, it makes it a little bit more, strengthens that first responder when they're out in that, you know, individual episode, that they can, you know, it'll help them guide them in their decision making. But the other thing about it, that's the great thing about Network 180's crisis line, which is staffed 24/7, 7 days a week. You know, Dr. Kim, I'm going to throw the number out later, by the way, just to make sure that
okay, so right there, please, we call them shameless plugs. So every opportunity that you get, throw out your shameless plug.
Well, what I would say is, you know, 24/7, 365 days a year, you know, anyone can call 616-336-3909, and there'll be a crisis counselor on the phone that can help talk someone through a difficult, or send them to the right place that they need to go, whether it's the emergency room, whether it's a inpatient psychiatric hospital, whether we need to send out a crisis mobile team. So, I mean, we want to make sure that we can show the county residents that all these resources are there for them, and that we're there to help. That's what we are. You know, I tell everyone, I work for the taxpayers of Kent County, so I'm on call 24/7. And that's the philosophy that all the staff at Network 180 bring to the table, as well as all of our wonderful contracted providers throughout the county.
So do police officers know that this is available? I mean, I'm sure that they're told that this is available, and I'm sure that there are, you know, notifications and education on that. But is there ever, and I'm, you know, I'm just asking, is there ever like every few months, you know, going into the police station or having some sort of dialogue to make people aware again, like that these things could be called upon, and that, you know, kind of just reviewing processes?
Well, here you answer that question.
Well, you know, but here in Michigan, for our police officers, they have to go through, they have their own specialized training. And in order to be a provider for them, you have to submit a proposal, get approved. And I can't remember the actual name of the organization that you have to go through, but it does have to go through them. They can't just, each department go through and say, hey, we want to take this training. It has to be approved through their system.
Okay, so that kind of answers one of my questions. The other one is, we had the riot. You know, there are still cities and states that are still experiencing this rioting. The crisis response team, do they have the ability to listen to the scanner, hear what's happening, and then kind of show up at the scene and just be available in case something happens and they're there to help navigate the police officers through it?
Unfortunately, we don't have that expanded capacity yet. One of the things that we were just successful in getting even before COVID was Network 180 was awarded a certified community behavioral health center. Along with that came $2 million to prop up our crisis services, to enhance it, to build out more. I think the goal would be get to that point where you have people who are watching, being proactive, kind of almost like the mental health unit that the LAPD has. I don't know if you're familiar with it, but they have a specific unit that's dedicated to handle behavioral health calls. We're not there yet, but again, getting to Lauren's point, we should always be refining. We should always be relooking at things and seeing how we can enhance resources. But I am hopeful that some of those cracks in the system, as far as crisis response, will be filled by this new grant, which is a great opportunity for Kent County. We literally just got it. It just started May 1st, so we're still in the ramp up stages, but that is going to help fund some additional crisis services, but it's never going to be enough.
Bill, that's amazing. Sorry, Dr. Kimberly. And I just wanted to say too that I wasn't trying to say that not enough is being done by any means, because I am so impressed with the organization of Network 180, and I'm constantly seeing the work that goes out into the community because of Network 180. And I just really commend you on those efforts and all of the the work that's being done on those crisis response teams, because some counties aren't even there yet and don't even have the resources that Network 180 has. And so just to credit the fact that we are doing so much in the community for the better of people.
Well, I can tell you, Dr. Kim, getting back to your earlier question, that one of the things that we have established with the first responders, not just with police, but with the ambulance services, is when they're on one of their runs, if they're determining that it's most likely a behavioral health issue, they're bringing them to our Fuller campus. And then we're taking the individuals. So they have a place to take them, because, in some of my past work, the only places they had to take an individual in those types of situations is either to jail or to the emergency room. And those are the two places we don't want them to take them to. We'd rather bring them to us, and then we can get them the help that they need.
I've even been talking to some legislators about reestablishing a state mental health hospital, which we had at one point in time here in Michigan, but that was dismantled back in the 80s. So we're talking about trying to reestablish that so that there is an alternative place for people to be treated.
I think all of that is wonderful, and I think it's all great. My job is to continually work on the areas that need work. It's not my job to stroke you and tell you, oh, I think you're great, I think you're wonderful, no disrespect to you. But when we continually see that persons are being picked up, they're being assaulted, and I mean, even when we talk about the seriousness of Mr. Floyd, 2 reports were done. 2 preliminary autopsies were done. One said, well, it's not my fault because he had an underlying health condition. That's why he died. So it's not my fault. The other one said, well, no, there wasn't any underlying health condition, but because of the way he was treated, it created a health issue. And that's the piece that we really need to work on, is that whether there is or is not, we should treat everyone, just like with COVID. What are they saying now? Treat everybody, even yourself, as though you're already infected, so that you will protect yourself and you will protect others. So why can't we presume that everyone that we encounter, when we go to talk to them, may have or is in the middle of, they got a disability, whether it's cognitive, emotional, or they're suffering from PTSD.
Or even physical. You know, we have people
Right.
that have physical disabilities who may be in a wheelchair, such as yourself, Dr. Kim, or they may be using a walker or some other type of
Ambulatory device.
Thank you.
And why can't we come from that standpoint instead of just assuming that everybody's the same, everybody looks alike, and I'm just going to treat them the same? And
Exactly. I'm sorry, I didn't mean to interrupt. I'm really passionate about what you're saying because, I mean, disability is the largest minority group in the world, and it's also the only minority group that any person can join at any time. And majority of disabilities are invisible anyway, and we know that and we say that, but we act like that's not the case. I use a power wheelchair. I have muscular dystrophy and I have a very visible disability, but I have also completed all of my training to be a counselor for disabilities of all types because there are so many disabilities and the disability spectrum is so broad, and we talk about this all the time.
That is why my business is called 100 Shades of Disability.
Mm-hmm.
Because I promise you, and I'm on this show, we are transparent. Nobody cared that I was suffering from PTSD, where there were times I was so depressed and, you know, would reel from depression to anxiety, that I tried to commit suicide. Nobody cared. There was like, you just need some more Jesus. We're going to pray for you, you know, take some Holy Communion and you'll be okay. It wasn't until it all finally mounted up. I had 5 head surgeries, found out that I had thyroid cancer and had to have surgery for that. And I had a stroke all in the same year. Head surgery, thyroid cancer surgery, and then had the stroke. And now it's like, as we began to unpack, okay, how did we get to this point of the stroke? Well, guess what? It was that underlying PTSD. It was that underlying depression that never got dealt with. It was just, and those things we call hidden, and to me, they're not, because they have a physical manifestation.
Mm-hmm.
It causes us to do things, to think things, to feel things, to respond to things in a way that we normally would not. And your brain is like, look, I'm on overload, and it just exploded in that moment, and it left me here in this wheelchair. And now everyone wants to rush to my aid and assist. And it's like, why do we have to get to the emergency point where we're doing an emergency surgery, we're doing emergency extraction, when the whole time I was like this, help me, help me, help me.
There's still so much stigma about mental health and mental illness, and it's something that we have to continue working toward. And it doesn't make sense, but there is, like Dr. Kimberly, you said people weren't there for you when it was just mental until it became physical. And that is so pervasive in our world, that people don't treat mental illness the same as they do physical illness. And that's a problem. And then also when we think about the intersectionality of people with physical disabilities that also have mental health conditions, I mean, it just complicates the matter even more. And it continues to spread disparities in how health conditions are treated. And that's why I care about treating the whole person and talking to healthcare professionals and people in the medical field to really not discount their mental health just because maybe they have a physical illness or something that is taking priority at that doctor's appointment. You also have to really think about their mental health.
Right. Because
one of the things I appreciate about you, Dr. Thomas, is that you put it out on Front Street. You say it is the Thomas Trauma Traumatology Institute. Unpack that a little bit for us.
Well, the reason I came up with that name, not just because obviously my last name is Thomas, but I went through trauma, multiple traumas. So what that's called now is complex trauma, when you experience more than one traumatic event. So I wanted my institute to be clear in stating that we treat trauma. I'm also a certified clinical traumatologist. So that's the population that I have a passion for, because there's a lack of trained professionals that actually can treat trauma. And we know that working with individuals with trauma, that's a special situation.
Absolutely.
Because that trauma can cause people to have flashbacks of that experience that they have. Nightmares can cause cognitive dysfunction, cause you to be isolated. Different things can trigger that traumatic event. It could be a smell from the trauma that you went through, and then you smell something and that triggers you. So I wanted to be clear in what my services provide.
Bill, how skilled are you and your staff at Network 180 to be able to, when someone calls in, be able to hear what she just described? You know, when if I'm calling you, I'll use myself as an example. Again, I'm going to be very transparent. I was sexually and physically assaulted while on active duty. And for me, it was the stalking. For some reason, we had a rash of those with several women while on active duty. So I was not the first, and I'm sure that there were others after me once I was removed from that situation. But one of the triggers for me, I lived in an apartment where you had to buzz in order to get into my apartment building. Mm-hmm. Well, the neighbor that moved in was nosy. And I tell you, she spent 85% of her time in the window. For me, that was very traumatizing. That when I would leave my home, you know, I would go to 4 a.m. prayer. So I'm leaving at 3:30 in the morning. She's sitting in her window at 3:30 in the morning. For someone who has PTSD, mm-hmm. had a traumatic situation, and this woman is sitting in the window, I would start reeling. And, you know, then it's like I come home from prayer. Now this is at 5 something in the morning. She's still in the window. If I go to the grocery store at 10 o'clock in the afternoon, she's still in the window. And then at 11 o'clock when I come back, I'm coming in the building, and then she comes to her door. Hey, how you doing? I'm like, ah! You know, that's way too much. So if I call Network 180 and all I can say to you is like, okay, this lady is looking at me and is upsetting me, and I think I'm getting ready to have an episode.
Mm-hmm. Well, one of the wonderful things that we have at Network 180 is we've got, I think, some of the best skilled clinicians on the planet. And the other thing is we've put together some very subtle pre-screening tools that we can use when we're asking questions, and we're going to be teasing things out that you might not even know what we're teasing out. And then that way we can then make the best decision on what the best next step would be. Is it an immediate crisis that we need to get you into some type of facility? Do we dispatch someone out up here? Do we call your case manager and have them do a home visit? And we also have access to, if you're an existing consumer of Network 180, then we can pull up your medical record on the spot, and we can say, oh, we know what the diagnosis is, we know what the triggers were, we know what's going on here, and now we can start talking through what a plan of action would be to kind of de-escalate that situation.
Well, I am a United States Navy veteran, So are you connected to the VA in some way that, because unfortunately not every veteran has chosen to go through the VA healthcare system?
So, another shameless plug for our CCBHC. As part of this grant that we got through SAMHSA, we do have to have, and a component of it is coordination through both state veteran services as well as the VA. And we have a coordinator at the Lakeshore Regional Entity that we would be working through on this. Now, normally, that's a big bottleneck, and it's a passion of mine, is how do we break down this silo approach between the VA and between community mental health. In my previous job, when I was I ran a provider in Southwest Detroit, we had a building that was devoted for Section 8 vouchers for homeless veterans.
Mm-hmm.
But it was called Paquette Square. It's one of the first in the nation. The challenge with that building was that because it was a designated as a preference for veterans, and the VA had an office in that, I could not deliver Medicaid eligible services to those veterans because they would have to go to the VA because you're required, because there was not a lack of resources. That's wrong. That's a federal policy that needs to get changed. I, as a community mental health provider, am well equipped with better tools to help these individuals stay housed, and take care of their behavioral health needs. So what did I end up doing? I went out and I raised the $300,000 a year that we needed, and we put counselors in the building, and guess what? Then we didn't have to worry about the VA. So that was a short-term workaround that I wasn't really happy about, because again, it means every year I had to raise $300,000 to keep, my counselors in that building. But you know what? We kept it at 85% occupancy. Some of those individuals have been there for 10 years. A lot of them have been sober for 10, 15 years because they had that access to that counselor on site every day. And we had, it gets back to treating the whole person. Lauren was talking about the physical and the behavioral. It's the physical, the behavioral, it's the supportive services, it's the economic workforce issues that you're facing, it's the affordable housing, it's the entire social determinants of health.
Right.
We have to leverage the entire safety net system to help these individuals, and the outcomes are seen. They go off the chart. These individuals have so much better lives because we're treating the whole person.
Mm-hmm. Now, my question to you is, how does the Thomas Traumatology Institute and Presutti Counseling,
Presutti.
Presutti,
there you go.
Lady P.
Lady P.
Lady P counseling.
That works.
And the Traumatology Institute, how do they connect in with you? Because that's really, at the end of the day, we're talking about, we have a whole state that we're trying to cover, as well as those who may be watching us that live in other states and other counties might say, oh my gosh, that sounds like a really great model that we would like to, adapt. But how would I get Lauren and Dr. Nakpangi in touch with you to say, okay, how do we come together? How can that $300,000 be spread out a little bit more? Or maybe I have someone here in Wayne County that needs those services. Can you show me how to make that happen here? Or can we tap in together? Or even bringing in Lauren as one of those counselors?
Well, I think that's a loaded question because I don't know how community mental health works and Medicaid, and sometimes there are different stipulations for how contracts can work with services. So I personally don't know the ins and outs of all of that, but I can say that even just on a collaborative basis, that I would be happy to be supportive to those efforts in any way that I can, whether it's through webinars or just getting more information or education out there to people in the community. If there are any things that that we can come together on, I would be extremely open to that.
Dr. Thomas?
Well, I know for personally that in order to be able to be a provider, service provider with the VA, you have to be approved or credentialed to take their insurance, which is TRICARE.
Yep.
Before I opened the time.
Well, they got rid of them. So we do have a new insurance company now, and I will give that to you after the show.
Okay, great. Because I'd had another business before this in Farmington Hills where we did accept TRICARE, and we were able to be service providers. But also, I'm a licensed professional counselor, and there was a time where we were not able to provide services to veterans at all. So, being part of the American Counseling Association, we advocated on DC at DC to include us as service providers because there's a lack of providers anyway providing mental health services. So it took us about 5 years before that was even approved for licensed professional counselors to provide services to veterans. But currently, what I do is I'm a subcontractor for other organizations that can see veterans. One of the providers that I go through is Healthcare Management Systems of America. So, and I even do EAP for the Detroit Police Department, the Sheriff Department, and other entities here in Wayne County. So I'm always welcome contractual work. So that's really how you do it. And then if you're doing a grant, I know it will have to be written into that grant for some, in order to have collaborations. Do you find that true, Bill?
Yeah, especially with the CCBHC that we just got. We had to actually identify all of our partners before the grant went in. So we're partnering with Cherry Health, and we're partnering with Pine Rest, and we're partnering with Arbor Circle, some of our bigger providers in Kent County here, and they're going to be working with us as we implement this new program.
Right. And even with some grants, they specifically want you to be a nonprofit organization. I'm not a nonprofit organization, so there's very few grants out there in which I can seek so that I can provide these services. But I do look for grants that cater to for-profit organizations. And at this time, I don't even take insurance. I do cash only. And for those individuals who cannot afford mental health treatment, I just provide pro bono service because I'm not going to turn anyone away, regardless if you can afford it or not.
Yeah, I know the insurance thing gets tricky. I'm in the process of being able to accept a wide variety of insurances, but right now I only accept Medicaid and all of the managed care Medicaid programs like Molina, McLaren, Meridian, Priority Health Medicaid. In about a month, I'll be able to accept Blue Cross Blue Shield, all of Aetna, all of the different United Healthcare, all of the different insurances. But it is a process to be able to accept all of the insurances. So I understand your struggle, Dr. Thomas, with doing private pay. But I do want to just put out there that I can accept Medicaid, and I know that a lot of people and families affected by disabilities have different Medicaid plans, and so I really enjoy working with that population, definitely.
Lauren, you're doing God's work, because I've seen those rate schedules, and that's really tough. They deserve to give you a rate increase.
It's definitely a broken system in terms of Medicaid throughout the whole state, but it's not about that for me. I really want to be a counselor that is specializing for people and families affected by disabilities, because I know firsthand that a lot of families hesitate to go to a mental health counselor sometimes, not sure if the counselor will even understand what disability is, what their life is like, what their perceptions, biases, stereotypes, or stigmas may be there for going to just any run-of-the-mill counselor in any private practice in the state of Michigan. And so I really like to be transparent and say, I use a wheelchair. I've spent my whole life advocating for people with disabilities of all types throughout many different nonprofits and organizations. I receive CMH services so that I can live independently in my community. I receive community living services. So I know the mental health system of, community supports, and I know how challenging that can be to navigate those things. So I'm in private practice as a social worker, as a psychotherapist doing individual counseling, and I provide telehealth to anyone in Michigan because I know that transportation can be a barrier. Telehealth, obviously, now with the pandemic, has been pretty much what every therapist is doing. But I had always planned to do telehealth even beyond the pandemic because I don't want there to be barriers or parents to have to get babysitters or driving out or, just all of the different barriers that come with accessing mental health. I want to make it easy for people.
Dr. Thomas?
I don't know what I'm responding. No, something else that I just wanted to add to that. When we're talking about using service providers, one of the challenges that I found when even securing a location are that some buildings are really not accessible for individuals that have wheelchairs. Even the door to get into the bathroom is not wide enough to have someone that may be in a wheelchair to even get in, not to mention the stall.
Absolutely.
So we have to do a lot of advocating. So, I mean, and this is at the federal level, so that these buildings are accommodating to our friends that have disabilities, specifically those individuals that are in wheelchairs.
I mean, that's one barrier of many barriers. I think definitely an important barrier that we need to look at, but we need to look at why there are so many families, parents of kids with disabilities, siblings of kids with disabilities, and people with disabilities themselves that are not seeking counseling services, that are not going out to live their best life because of wide variety of barriers, definitely structural barriers with buildings and accessibility, social barriers with not knowing if the counselor will understand, or just all of that. And then ableism, just thinking that they're not worth getting the mental health treatment or living the happiest, best, most empowered life that they can. And I just think that we need to do more, and that more families could be benefited from counseling. I know, when you go to a doctor sometimes at some neuromuscular clinic, they don't even ask if you want to know about counseling services. They just treat you for your physical disability or whatever the case may be. But, they'll get you set up with a wheelchair, they'll get you set up with mobility equipment or braces, and they don't even refer to counseling. They don't even ask about it. And I think there are so many.
I'm going to stop you right there, Lauren. I'm not sure where it is that you go, but I know that in the last 5 years, all medical facilities have changed their policy where they have to ask you those questions. So they are. I'm
glad to hear that, for sure.
They're not doing it for you. Maybe somebody just needs to go tap, 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 get that done. And you're a good person to do that. If you don't want to, I certainly love making those kind of phone calls.
You should. Yeah.
But they definitely now, especially with the number of domestic violence cases, the number of human trafficking, they've even gotten really cute with this, with the human trafficking, where they will take the girls in if there's some medical issue, because guess what? That's their moneymaker. So if you've got some kind of disease, or you need to get something fixed, or you got pregnant or whatever, they need to get that taken care of. And so they take them in, and those questions are asked. Are you safe right now? Do you feel okay? Who brought you here? What is your mental health? Is it safe? Is it safe for you to be at home? So all those, as you call them, teaser questions, that we may not know why you're asking the questions. I think Mr. Bill stated that, you know, they have a way of doing these teaser questions. So in case you are, and I know this is very close to Dr. Thomas, she loves about human trafficking. So if my human trafficker brings me into the emergency because somebody that they gave me to beat me and I have a broken arm, guess what? I got to get fixed. And so they have those teaser questions that they ask that you can answer. And if you answer a certain way, they're trained to look at the body language, how that person is standing next to you, so that they know, oh, you're not safe. No. Because look at my face, I'm like this.
Right. And let me chime in. I'm also volunteer with the American Red Cross. And we even ask individuals who I used to be on the disaster team. And when somebody had a house fire, we would go in, assess the damages and see if they needed a place to stay. But we also asked them if they wanted to be contacted from a mental health professional, which
so
the American Red Cross also provides mental health services. And now I'm a part of that team. So you have quite a few institutions now that are looking at counseling services because they're seeing that people are being impacted emotionally and psychologically. So they're providing these services. And there was something else that I wanted to touch on, but it escapes my mind right now. If I think about it, I'll come back to it.
Okay.
I'm so glad that they're doing that. We need more of that, and I think it's just going to be on the rise. And I'm just maybe not in some of those places where I see that happening, and I'm really glad to hear that you've noticed it in many different places. Because I think treating the whole person is so important.
Well, as much as I love each and every one of you, I think this has been a wonderful conversation. And it's definitely been eye-opener. It opened up some doors for some new relationships to be formed. I'm just going to give you a couple of seconds because it is now 4:53. Can you believe it?
All right.
We've been here almost an hour. So we'll start with you, Mr. Bill. Please do not hesitate to plug yourself.
Oh, I won't. I won't. You know, I just in closing, thank you again for having me on, Dr. Kim. I keep telling my staff to get ready for the second wave, and it's not the second wave as it relates to the virus. It's the second wave as we emerge, as we hopefully begin to heal as a nation.
Yes.
I mean, we really have had 3 pandemics going on right now. We had the virus pandemic, we have the economic fallout pandemic, and then this country is just, it needs to come together and heal and have an honest.
You can say it, a racial pandemic.
Yep, it's a racial pandemic, and in the need for mental health services, for safety net services, is going to quadruple. I'm looking at internal numbers to say that the Medicaid population is going to go up by 55,000 in Kent County alone this year. Again, you know, we come up with a motto under the pandemic, which is don't go out, reach out. And I'll say it again, don't go out, reach out, call us, we're there. 336-3909, 24/7, 365 days a year. And again, thanks so much for having me on, Dr. Kim.
Thank you for answering the call. Lauren, you got 1 minute.
Thank you so much for having me, Dr. Kim, and thank you, Bill and Dr. Thomas, for all of your insights. I'm so grateful for the work that everyone is doing in the mental health field, and I'm just really passionate about it. And I think that a lot of people are hurting right now and that it will be on the rise. And so I just feel grateful to be a counselor in this community.
Give your number, Lauren. How can
people
you?
Go on my website, PresuttiCounseling.com. I'm also everywhere on social media, Facebook, Instagram, Twitter. I have a YouTube channel. there are lots of different ways that you can get in contact with me. And I'm also doing free messaging right now. So if you have a question, I know sometimes it can be hard to call a therapist and ask questions on the fly, but you can always message me on my social media for free, or to schedule an appointment for telehealth. You can call 616-754-9420.
Please pronounce your name and spell it.
Presutti, Presutti. That's T as in Tom, T as in Tom, I always have to repeat it a million times on the phone with people. It's Presutti. It's just Presutti, PresuttiCounseling.com. Thank you so much for having me.
Dr. Thomas, Dr. Nakpangi Thomas.
Dr. Nakpangi Thomas. And I want to thank you, Dr. Kim, for having this forum and discussing the importance of mental health and focusing on post-traumatic stress. This group clearly understands the connection between mental health and physical health. We know that having distressful mental situations can also lead to physical impairments such as heart attacks, hypertension, aneurysms. Stress is actually the #1 leading cause of death that goes untreated. So we want to make sure that we are focusing on our mental health, so that we can live a full, successful life. I can be reached at area code 313-651-9043. And I also have a Facebook page with my first names, Nakpangi, spelled N-A-K, P as in Paul, A-N, G as in George, I, Thomas, and it's called Let's Chat. So I'm always posting useful information on mental health interventions. So things that you can actually use to positively impact your mental health.
Thank you so much, all of you, for showing up. In my epilogue, my name is Dr. Kimberly Barrington, and many of you know how to reach out to me. But on today, this was very close and near and dear to my heart, because I am 100% permanently and totally disabled due to post-traumatic stress disorder by the United States Navy and the VA. And I live well. I am ashamed to say that when I was suffering from depression and other mental issues, that I did not go get help, and they manifest themselves physically and caused me to have a stroke. And now I am 7 years a wheelchair user, and I wholeheartedly encourage you to please seek out help. There is no shame, absolutely none. We know that many persons of color, whether they are brown or they are Black as myself, we have always been taught what happens in the home stays in the home. Well, guess what? The home will kill you. It will collapse down on you, and it will suffocate and kill you. That is no longer true. There are so many things that we have been taught that have not been true, and we have suffered as a people because we did not go and get help. Yes, there are some people who are not good, but there are so many that are, and we cannot allow those who are not good to overshadow the 95% of the population that is good and that is doing well. I am a living example of when you go and you get help, you can live a full life, not just a quantity of life, but a quality of life. Many of you have seen, I have shared my home. I have been extremely transparent. I've shared my journey. I've shared my journey. And you have seen that there is hope. There is life after trauma. There is life. You can see my home. You can go online and see the home that I live in. You can go online and see the car that I drive. But I had to do the hard work. Yes, I had to do the hard work. It was difficult. It was so easy to fall back into those patterns because I knew how to survive. But guess what? I want to more than survive. I want you to more than survive. I want you to live a good life, a quality of life, and you can do that. So we have 3 individuals here who you can reach out to. We have the east side, we have the west side, and then we have Network 180, who's kind of like right there in the middle. And if you are a person of influence, begin to write, because that's what it takes, is the person who has the influence, that has the language to write out these public policies and procedures, write bills. Help us, help us, help us. I am a perfect example that when the system works and you work the system, you can live well. Again, this is Dr. Kimberly Kennedy Barrington, and you have been rolling on the road with Dr. Kimberly and Dave. Dave, of course, is on another assignment, rolling another place. And we thank you for tuning in. God bless. And you are an essential solution. So if you have to go out, put a mask on it. Thank you and have a blessed day. All right, guys. We're gonna click. Did I do that right? Yep.